Have you ever wondered why adjustments actually reduce pain? So it's more of modulating a threat versus fixing the parts. As we go into this, I'm Dr. Darren Howarth with Summit to Shore Chiropractic, and going over some new research talking about more supporting the fact that adjustments are more of a neurological change versus a structural fix. So in this one, I'll focus a lot more spine related in the sense of what's actually doing. So common question, concern, people come in like, oh, my bone's out of place, or my joint is stuck or out, whatever the case may be. So just confirming that that's not, you're not literally kind of falling off of each other. There's instances that happen, but most of the time if you're walking in here, not likely that scenario. But what can happen, there's an injury there, things stiffen up and things are different. We'll say that for now. So adjustments, a big thing that's doing is not necessarily putting that joint back in place, but more of turning down the brain's like pain volume. So we're just modulating some of that neurological input. Some of those things that they've shown that is affected with adjustments and that those popping, whatever you want to call it, is the serotonin levels, dopamine levels, endorphins, your descending pain pathways. They're all changing with those adjustments. So there's a lot of neurological input that's going into that area with those adjustments. So more or less it tells the brain that you're safe, you can reduce the threat, we can reduce the pain, things are okay. And there's a lot of different ways too, like an adjustment, like a big, like where you get that popping cavitation versus physical therapy versus mobilization, massage. They're all a little different. They're telling the brain, it's all different ways of trying to get the brain to accomplish the same thing, those modulating factors to be able to change the perception that is actually going on. So again, this is just more of an adjustment tends to calm the nervous system a little bit more, which is going to help you heal faster by stimulating that area and that nervous system where there's a concern. So there's a lot of cool things that are going on that are not just as simple as like, ooh, I'm out. Yeah, you can have scenarios where things are stuck in the wrong position or whatever the case may be, and an adjustment may help in those scenarios for sure. But they're showing on primarily a lot of why that happens is the adjustment helps stimulate the nervous system, and then the brain starts to do more activity and change what's going on in that injury, and then it adapts and figures out how to adapt to it to make it not hurt as bad and to move better and feel better. So again, this one's one of those, it's like if you're really curious and what's actually going on a little deeper level, it's kind of interesting. But again, research keeps going further and further supporting that adjustments can do really well, and chiropractic can do really well with improving pain scores and pain sensation and help us to move better. And there's a lot of reasons why for that, more than just it's stuck kind of scenario. So I'm Dr. Darren Howarth with Summit to Shore Chiropractic. If you have any other questions, concerns, definitely reach out. Love to answer those, and we'll talk to you soon. Have a good day.